Odell here for LateralTraumaPosition.org. This video demonstrates a technique to put a patient from a supine position on a traditional long backboard to a lateral trauma position on an ambulance cot. So say you've extricated a patient from a wrecked vehicle onto a longboard, or say you've log rolled a patient onto a longboard in whatever manner you usually do. But now we want to transport the patient in the lateral trauma position. It's important that we're going to lift from the ends. The provider in the middle is there to make sure the patient doesn't roll off the board. He shouldn't help with lifting at this point, or he may unbalance the board. And it's preferable to lift the board straight up and slide the stretcher underneath rather than move the board to the stretcher. We're aiming to put the backboard over about 1/3 of the mattress. This should ensure that the patient's torso ends up centered on the mattress. Now, a couple of important points are that this person here needs to make sure the stretcher doesn't move. Here she's holding it with her legs. The other thing is for the providers lifting from the ends, they need to keep supporting the majority of the weight. It would be a mistake to let the stretcher take the weight at this point. So next, someone is going to take control of the patient's head, and on that person's count, the patient is going to be log rolled up onto their left side. Then the board is removed, and bending the legs like this enables some stability in the lateral trauma position. Next, we're going to pad under the patient's head to maintain an inline position, and we use folded bath blankets for this. Next, we apply the straps. We didn't provide any padding at this point, but you can see some photos of that elsewhere on the LateralTraumaPosition.org website. Securing the top strap over the shoulders like this is taken directly from the Norwegian lateral trauma position playbook. It makes sense that placing it that way might help keep the patient in place in a harsh braking situation. Of course, try really hard not to get into a harsh braking situation in the first place. Now, before we finish, let's go back to the placement of the longboard onto the stretcher. Placing it where we do here will likely work for almost all patients, but if you get a patient with a large AP diameter or a pretty obese patient, you may need to scoot the board further out to make sure that the midline of their torso while on their side is in the middle of the ambulance stretcher. If this is the case, be careful, get plenty of hands, and keep the weight of the board off the stretcher until the log roll is complete. Otherwise, you could end up flipping the stretcher, and that would be bad. So let's practice.